So type 1, out of all of the long-term conditions that are out there, is one of the most arduous and very, very frustrating conditions to live with. So a person living with type 1 has to make 180 decisions on top of everything else in life every single day. And it's constantly there, and it's very, very unpredictable. So what works for you on Monday will not work for you at all on Tuesday, and that really starts to have an effect on people. So there's all sorts of issues directly related to type 1 that can make people really find things difficult. So they're more likely to get stressed, distressed, and that might tip over into things like diabetes, burnout, or depression. But then, of course, we know there's lots of people who have other issues going on in life. So it might be that you've already got some psychological issues going on even before you were diagnosed. It could be that you've got some neurodivergence like ADHD or ASD that makes it really difficult to manage your diabetes. Or it could be that you've been through other really difficult experiences in your life that just make living with type 1 a lot harder. So it's really important that we get that support in place and really help people to live well with type 1. If you are someone who's living with type 1 and you find that you're struggling and you're getting stressed out, you are normal, you are human. It is so, so normal to find this difficult. It's one of these conditions where, on top of everything else that's going on in life, with your job, with your kids, with your work, everything else, you still have to do all of the diabetes stuff on top. So living with type 1 means that you don't just have to be at 100%, you've got to be at 130% all of the time. And so finding that difficult is so, so normal. The number one thing I would say to people with diabetes is that you are not and you will never be a pancreas. That managing this is really complicated, it is difficult, it is frustrating at times, you will not get it right all the time. And that is okay. So try and be kind to yourself. Remember what is important to you in your life, and try and build diabetes around that rather than building your life around diabetes.